Actually, welcome everyone. So right now we will be looking at respiratory physiology and the anatomical structure which involves respiratory tract and the anatomy of lungs and a little bit physiological portions of lungs. So first of all, the when it comes to respiration, then we will have to look at the nasal cavity from which air enters into the nose and goes down into the trachea, and then it goes down into the lungs. So the main function of lungs is to take or inhale oxygen and exhale carbon dioxide. What happens during inhalation causes diaphragm to come down. Descendant of diaphragm happens during inhalation, and in this way gas exchange occurs. Now for anatomical purpose we will have to look at the nasal cavity, and from nasal cavity down there is the pharynx, oropharynx, nasopharynx, oropharynx, and then laryngopharynx is there. So in this way, pharynx is involved in the upper respiratory tract, and then there comes the trachea, which has smooth muscles in it. In trachea there are smooth muscles which contains ANS, matlab autonomic nervous system is present in this ANS. ANS comprises of two types of systems, nervous system. One is sympathetic nervous system and another is parasympathetic nervous system. So sympathetic nervous system is involved in fight and flight mode, while parasympathetic nervous system is involved in relax. Person is relaxed and in normal position or normal in daily life. That is parasympathetic nervous system. So trachea contains smooth muscles which contains beta 2 receptors. Means when sympathetic stimulation occurs, beta 2 receptors causing dilation of trachea and facilitation of gas exchange of carbon dioxide and oxygen. Another anatomical structure of the lungs is there is right lung and there is left lung. In right lung there are three lobes and divided by two septa, while left lung A consists of only two lobes with only one septa. So in this way, lung is divided into lobes. Now another remarkable structure of the lining of the trachea having ciliated columnar epithelium, pseudo stratified ciliated columnar epithelium, and then after trachea there comes bronchus, right bronchus and left bronchus, which then divides into bronchioles having 15 to 20 generations, then terminal bronchioles, and then comes the respiratory zone where alveoli are present. So in this way respiration occurs through these mediums. Now this is anatomical structure of alveoli, which has pneumocytes in it. Pneumocytes are the cells of alveoli which are type 1 pneumocyte and type 2 pneumocyte. Type 1 pneumocyte has function of structural support, while type 2 pneumocyte has function of surfactant. Means these increase surface area and prevent collapse of alveoli. So in this way alveoli are present. Now another physiological landmark is when lung having pulmonary artery and pulmonary veins. So from right ventricle, pulmonary artery carries deoxygenated blood to the lungs for oxygenation, and from lungs pulmonary vein carries blood to the left atrium for uh, further distribution of oxygen into the systemic circulation. So both of lungs has different zones which are divided on the basis of ventilation perfusion ratio. What happens when alveoli has a lot of oxygen? Ventilation occurs there, while perfusion means blood comes through vessels, and that is ventilation perfusion ratio, which is highest in lower lobes. Why? Because there is more gravity, and that gives more clue for ventilation perfusion ratio. So in this way, a physiological structure happens in the ventilation perfusion ratio.